Today in 2021 has been a miraculous year in vaccination. So we're going to actually talk about so much about vaccination. People have concerns about vaccines in general, and we'll try to look what we do know, what we don't know. So the team has put together a fantastic talk. We have Remy, our local pharmacist, is here tonight, and I'm going to get a vaccine tonight. If anybody can guess which vaccine I'm getting tonight, we'll put you on a draw for a book or so. Let's see what the next slide will be. Okay, what are we talking about?
So, yes, thank you, Dr. Canu. So we're going to go over into some really cool topics, like what is a vaccine. We'll then talk about vaccine mechanisms, different types of vaccines, who should get vaccinated, and then end it off with a bang with spotting misinformation and myths. So let's start off right from the beginning with what is a vaccine. Awesome, thank you. So what is a vaccine? Well, a vaccine is basically a medication that produces immunity to specific diseases. They are generally administered either via mouth or via nasally, so through the nose, and they're designed to help prevent these diseases, not treat them. So for example, you would not receive a vaccine to help treat COVID-19, you would receive a vaccine to help prevent contracting COVID-19. Currently, there are 27 vaccine-preventable diseases such as smallpox, shingles, and measles, meaning that there are 27 approved vaccines that exist. Vaccines are also critical to the prevention and control of infectious disease outbreaks. Vaccines are basically essential for the elimination of diseases. And then next slide. Thank you. So being immune to a disease doesn't exactly mean that you're protected against contracting it. It's just being immune to the disease doesn't mean that you're protected against contracting it. It just helps protect you for the future. So vaccines basically train your body's immune system by causing immunity to a specific disease by evoking an immune response, so that your body uses the same bacteria and viruses that cause the disease in the case that you are exposed to it in the future. The immune system can therefore recognize that bacteria and fight the disease if you are exposed. There are also immunodeficient populations. So immunodeficient populations due to congenital diseases and illness or medication that suppress immune function, such as medications for rheumatoid arthritis and inflammatory bowel disease. So safety and effectiveness of vaccines in these patients is determined by two things. One of them, type of immunodeficiency, and the other, the degree of immunosuppression. And there's also potential for serious illness if immunocompromised patients are under-immunized because they're at a greater risk of infection. So every effort should be made towards these populations because they're at a greater risk for infection. And just a quick fun fact, over 3.6% of the entire US population is immunocompromised, which is a very gigantic number.
So this is actually kind of important. I think we learned a lot about our immune system. So the best immune system are in young adulthood as you grow up. So when babies are first born, their immune system needs to be developed. In fact, breastfeeding actually passes immunity to certain diseases and tries to strengthen the baby. As we grow up, we develop our immune system, and some people actually feel that exposing people to different pathogens can actually train the immune system, and so that becomes important. Unfortunately, as we get older, our immune system starts to fail, and certain diseases. So you mentioned things like rheumatoid arthritis, inflammatory bowel disease, HIV, are just examples where the immune system isn't working up to par. And as you get older, we get chickenpox when you're younger. The virus lays dormant and it can reappear in times of stress and things of that nature as well. And we learned from COVID, unfortunately, is that people unfortunately who tend to pass away are the people whose immune system is not as strong. And that's one part is age. So, and if you have, and also learning that I made my immune system much better this year by decreasing inflammation, by losing 10, 20 pounds, by exercising more. So one of the things I'm going to talk to you about is to get your immune system to work better, so good lifestyle changes. For instance, if you exercise on a regular basis, you have less lung infection. And also, too, we learned about just infections in general from wearing masks, for instance. And we'll talk a little bit about surgical masks versus just cloth mats and different layers, and a little bit about that as well. So, social distancing. So this year, influenza, a virus that we see a lot in the wintertime, is basically not here because we're keeping apart, we're keeping our distancing, and so we've got lots to think about this. So one of the things is that who should get immunized is that people who have the weakest immune systems. You have to be smart about it, and you have to take care of your immune system. So that means not smoking, not drinking, exercise, keeping skinny, controlling your risk factors from diabetes, hypertension, and cholesterol are a few examples of that. So thank you for sharing that. Next slide.
Perfect. Okay. So there are also many things that can be done to ensure that immunodeficient populations are protected from vaccine-preventable diseases. And some of these safety measures can include one, immunize at a time when maximum immune response can be anticipated. So for example, it's best to immunize prior to any planned immunosuppression. So if you are taking medications that suppress your immune function, then vaccines should be administered prior to taking that medication. So stop or reduce the immunosuppression to allow for the vaccine to respond if appropriate. And another thing you could do is consider the immunization environment. So vaccinating family members or other close contacts is super important, and strongly encouraging up-to-date vaccinations for all healthcare providers in contact with the immunodeficient patient is, again, very important. Number 3, you could also avoid live vaccines and only administer inactive vaccines. And what do I mean by this? Well, live vaccines are basically vaccines that contain weakened forms of the disease. So, for example, measles, smallpox, mumps. But inactive vaccines contain actually killed or dead forms of the disease, like hepatitis A or flu shots or rabies. Okay, and then if you do choose to take the vaccine, how could you prepare for that appointment? Well, there's a couple things you could do. One, do your research. So learn more about the vaccine. For example, the COVID-19 vaccine is safe and 95% effective, but not 100. And it doesn't contain the live virus, so it can't essentially give you COVID-19, but we'll be discussing that more in the upcoming slides. Another thing you could do is eat beforehand and arrive well rested. This will help your immune system work to its fullest potential. You can be ready to schedule your second appointment, since both the Pfizer and Moderna vaccines have 2 shots that are spaced 4 weeks apart. You can also keep your vaccine record card safe. At your appointment, you will receive a vaccination card with your name, date of vaccination, and type of vaccine, so Pfizer or Moderna. Take a picture of this card so that you don't lose it, and make sure you get the same vaccine at your next appointment. Another thing you can do is continue to follow CDC guidelines to reduce the spread of COVID-19, because you're still susceptible to contracting COVID after your first dose, and it can take about 2 weeks after your second dose to develop full immunity. And as Dr. Cooney mentioned, we also have Rami here today from the pharmacy. So Rami, if you want to add anything about the process of preparing and receiving a COVID vaccination.
Very much for this opportunity, and I'm glad to be with you guys. Yes, so the city of Hamilton today had its communication publicly just a few hours ago, the procedure and how to register for the vaccine. The highest category risk will be 85 plus elderly people in the first phase of this current or phase 2 actually, because phase 1 was mainly the work like nurses and all the home nursing homes. So I advise people to follow up on the Hamilton website, Hamilton Health Sciences website, and they will find how to register for the. And if you're working in community, there's like a good number of actually maybe 20 different jobs. Not only pharmacies, but even people working in environmental also positions. They are also considered high risk. So there's highest risk and high risk. So they can also register for that. And I encourage everybody to do that if they are willing to take the vaccine. That's mainly the logistics of it. After that, We don't have any info yet, but I think after this phase, there will be pharmacies that should help with the rollout for a bigger population, of course. So that's maybe what I have for now. That's maybe the logistics thing. After that, we don't have any info yet, but I think.
Okay, so this sheet that you're seeing here is a vaccine consent form that Dr. Kernew gave. But if you go to the next slide, you'll see the official 5-page document for the consent form from the Ministry of Health and the Government of Ontario. I just want to highlight on page 1, it asks if you previously had a severe allergic reaction like anaphylaxis to the COVID vaccine, if you previously had it, or the ingredients, in which case you would have to consult with your doctor for best steps. And we also have on page 2, if you are pregnant, have a bleeding disorder, or take a blood thinner, or have an autoimmune disease, all of which are super important to consider before taking the vaccine. And consulting with your doctor is the best option.
So remember, if you're allergic to vaccines, people who give vaccines are prepared to treat reactions to vaccines. So doesn't mean you can't get a vaccine. It just means you have to be in the right environment, and people need to learn how to treat reactions. Important to realize that if you have a weakened immune system, that makes me want to be at the top of the list right off the bat. Issues about pregnancy are always ongoing, and that's an individual decision right now. Pregnancy does increase your risk of complications with COVID, but most women who are pregnant are relatively healthy. So and the effects on the babies are unknown. But I think at this point in time is that the rollout of the vaccines has been tremendous, in the sense of the research that's been done right now is that in the space of 1 year, 10 years of work was done. And I am truly amazed, and I really say this, it's like landing on the moon in 1 year. The amount of willpower, research, and smart power behind this are truly amazing. Just so you know, the Pfizer vaccine, its phase 3 trial had 40,000 patients, Moderna 35,000 patients. Most vaccines, before they come to clinical practice, have never had that degree of testing. So we know it's a very safe and effective vaccine. How long it lasts for, we don't know yet. And all the other phases of the trial were done simultaneously. Usually what happens, you do one step at a time, but what the companies did is that they did everything in parallel, just at the same time, which is truly amazing. So, and if you would have told me a year ago we would have effective vaccines, and we have more to come right now, and there's been over 200 vaccines that have been tested. Some have made it, some have not, and some are still to learn right now. So amazing, truly amazing. So I can't wait to get mine. I'll take anyone I can get.
Absolutely, I agree too. And then if you go on, so page 3, this includes the symptoms of COVID-19, just to be sure. And most importantly, it asks for your consent to receive the vaccine. That's super important. And then the next page, which is the final page of the vaccination consent form, it's on the next slide actually. Thank you. Yeah. So this 5th page, it just highlights the Long-Term Care Homes Act of 2007, which outlines a resident's consent to receive the vaccine can be withdrawn or revoked at any time. So Rami, would you like to make any comments here about the costs and coverage of the COVID vaccination?
COVID vaccination is covered by the government. People will not pay any thing for it. It is covered for everybody. And it's just the rollout of it is longer than usual in terms of all population because of course, to maintain the supply ongoing and to prioritize based on the risk factors. So at the end of the day, I think by September, everybody should be already vaccinated, and it's a very fair, and I see that it's an extremely extensive process to do your best to be fair to everybody. And I think they're on that side. I'm seeing lots of great things happening. So it is zero cost for any person living in Ontario.
So remember, if someone's charging you for the vaccine, there's something wrong. You've already paid for it through your tax dollars.
Yes.
Thank you. And again, if you have any...
Everybody should go look at that form, download it, start thinking about it, and start asking your questions. So people do so right now, the time to get that form is now. Is that if you and bring up questions that you feel are relevant to yourself, okay? And don't wait till the last second. Do it now, and get all your concerns addressed right now. My biggest concern is how we're going to get everybody vaccinated at the right time. That part is going to be a challenge. So if someone offers you the vaccine, get it as quickly as you can. Make it a priority.
And if you don't know where to find it, if you just search up COVID-19 vaccine screening and consent form Ontario, it should be the first link, and it's a 5-page document. And again, if you have any questions about the vaccine, don't hesitate to contact your doctor, like Dr. Kernew, and I'm sure they would all be more than happy to help. All right, so let's say you got the vaccination, now what? So after the vaccination, it is normal to experience some common mild side effects. These include fever, pain, swelling, or redness at the site of the shot, chills, fatigue, headache, muscles and joint ache, and nausea. But these side effects basically occur because your body is evoking an immune response against what was in the vaccine. And this is a good sign because it means that the vaccine is doing its job. The immune system is basically learning how to fight the disease and creating new antibodies that will help fight it in the future if you ever get exposed to it again. And although it's rare, it is possible to experience some more serious side effects, which in that case, if you are concerned, you should contact your doctor. And if you are experiencing discomfort and would like to treat these mild side effects, all you have to do is rest. It's basically your body's natural immune system fighting the killed or weakened molecules within the vaccine. So you can do the advice that's listed on the slide, like drinking lots of fluids, putting a cool wet washcloth where you are sore, taking a non-aspirin pill, pain reliever, with the doctor's approval, that's important, and ensuring to move your arm around if it is sore after the shot.
All right, so now moving on to vaccination mechanisms. We're going to be talking a little bit about the vaccination mechanisms, but then we're also going to be going into a little bit of how to prevent against a disease like COVID-19 beforehand without needing a vaccine. And to start that, we're going to talk about social distancing. And at this point, everyone should know what social distancing is. Social distancing basically means keeping a safe distance, which is typically 2 meters away between yourself and people who are not in your household. You might have heard the term flattening the curve. And the idea behind flattening the curve, it basically shows us what would happen if the spread of the virus slows down. Even though there might be the same number of people getting sick, the number of infections that happen over a longer period of time. So then there's more ability for hospitals and other healthcare workers and providers to be able to treat everybody. So the next point of intervention that we can use is mask wearing. It's common knowledge that masks are effective, but it might not be common knowledge that masks are designed to be able to keep or isolate any particles that come out from your respiratory system to yourself. It might not necessarily be as effective at protecting against particles in the air or COVID in the air. For example, like a recent study demonstrated that one, material of your mask actually matters a lot, and also that if you just wear cloth and surgical masks in public, it doesn't reduce COVID-19 infection rates among wearers by more than 50% in a community with modest infection rates. However, other masks like the N95 are demonstrated to be more effective in blocking out these SARS-CoV particles from spreading, and they advertise an over 90% filtration of particles that are smaller than 0.3 micrometers. So when you're considering your mask choice, you have to be practical. Most people don't have access to the N95, but surgical and cloth masks are still effective at reducing COVID-19 transmission, as we'll see in the following video, which is on the next slide. All right. So this is just when you cough normally. And you can see how the droplets are going out all the way to 6 feet, which is why there's that 2 meter recommendation. And if you could skip to 1 minute 50 in the video. Perfect, thank you. Yeah, so this is with a mask, in this case a fabric face mask, and you can see the difference. And moving on, I'll show you how different materials of masks can help prevent or limit the COVID-19 in different ways. Okay, perfect. If you could go to the next slide. Thank you. Yeah, so the design of masks is very important when you consider what type of masks that you want to wear. Well-designed and well-fitting masks can help limit the spread of your infectious respiratory droplets. And you should know that your mask should always be made of at least 3 layers, 2 layers being like a woven material like fabric, cotton or linen. And then the third or the middle layer should be some sort of filter that is able to kind of like prevent that spread. And you can see some funny examples of, well, quote unquote masks there. Okay, so now we're going to be talking about a RCT or a randomized controlled trial that assessed whether we should be recommending surgical mask use outside the home and whether that reduces the wearer's risk for COVID-19 infection in a setting where masks are not typically common or recommended by public health procedures. And basically the conclusion was the recommendation to wear surgical masks to supplement other public health procedures like social distancing. It didn't reduce the COVID-19 infection rate among wearers more than 50%. However, there are various limitations with this study that we'll discuss further, for example, like inconclusive results as well as missing data.
So to me, this study shows this, that the number reason to wear a mask is that you don't make somebody else sick. Surgical masks were designed initially for surgeons, so surgeons didn't put their secretions on their patients. Now, this study is a reasonably good study, and it tells me that it probably decreases transmission a little bit, maybe 20%. It's a non-significant train right now, so I'm not going to belabor too much about masks anymore. Wear a proper mask, make sure it fits above your nose, and if you don't wear a mask, you've given yourself the right to kill somebody if you have the disease. I'll repeat that. If by not wearing a mask, you've given yourself the right to kill somebody. Your disease may be symptomatic. So that's the reason why we should wear masks. That's the reason why we should social distancing. This is good for all, airborne diseases. So you know this, and I don't want to belabor this anymore. So please, please, please think about others. Next slide, please. I don't want to spend too much time talking about this. Next slide, please. Is that wear surgical masks, wear masks that are important, social distancing. If you're sick, stay home. And let's hear about some of the history about vaccines in general. Thank you so much for presenting that. Tell me about smallpox.
Yeah, okay. So yeah, vaccines aren't new. We viewed them successfully long before it was even understood how they've worked. but it's been documented as early as 1796 when Edward Jenner, who's a British physician, successfully tested the first smallpox vaccine when he noticed that a milkmaid who had cowpox was not infected by smallpox. So he tested it, as you can see there in the picture with the younger boy. And this was kind of like the first idea of inoculation or protecting against a more deadly disease by issuing or priming your immune system with something that's harmless. And the modern science of vaccination was further developed later on by Louis Pasteur. And as you can see with the image on the right-hand side, you can see examples of vaccine development through history. For example, polio all the way to what we have now, coronavirus. And hopefully, it's my hope, at least, that our coronavirus response resembles that of swine flu and not polio. All right. So just some general vaccine mechanisms, just to explain how vaccines work. More or less what happens in inoculation is you'll get some sort of attenuated, which means it's no longer harmful, virus or particle or toxin or part of some sort of pathogen that's going to be infecting you. And that allows your immune system to build a response and mount a response to that. And the immune system kind of has a memory, so it's able to save that response and the way it built it, so that the next time it encounters that same pathogenic bacteria or virus, it can mount that response quickly and make it so that there is not a lot of damage done by that virus, and that's how it basically protects you against disease. And there are 5 types of vaccines that we want to be talking about today. The first type is the mRNA vaccine, which has been getting a lot of attention recently because this is the type of vaccine that the COVID-19, where the big COVID-19 vaccines have been are under. And basically, they just contain material from the virus that causes or that gives our cells instructions on how to make a harmless protein that is unique to that virus. And once our cells are able to make that copy of the protein, they destroy the genetic material from the vaccine, and the body recognizes that protein should not be there, so the immune system has responded. The immune system responds and mounts that response. And the next time you are infected with this virus and it makes this protein, then your immune system knows, okay, we're going to mount that response to try and take it down. So it makes our immune system a lot better, a lot more primed for the second time we get infected. The second type of vaccine is the vector vaccine. Vector vaccines are somewhat similar to mRNA vaccines, except the difference is basically they use a harmless virus as kind of like a shell, as a way to deliver the genetic material that's inside that gives the cells the instruction to make that harmless viral protein as a little bit of like a carrier. And just to clarify, like vaccines such as like the Pfizer vaccine and the Moderna vaccine, they're part of that genetic code vaccine or the mRNA vaccine category, whereas other COVID-19 vaccines like the AstraZeneca or the Oxford vaccines, those are vector-based vaccines. Some other vaccines include subunit vaccines, where basically they'll just inject harmless proteins from that virus directly into your body instead of the entire germ itself. And our immune system mounts that response again, which means the second time around, we'll be able to respond to it better. And then we also have live attenuated or inactivated vaccines. Live attenuated, basically, they use like a weakened form of the germ or the pathogen that caused that disease, whereas the inactivated vaccines use a killed version of that germ that causes the disease. Live vaccines usually cause a very strong and long-lasting immune response, so only one dose typically takes you through. However, the inactivated vaccine is not very strong, so it often means you have to get booster shots just to have ongoing immunity. And in the case of live vaccines, you have to be careful, because if you're immunosuppressed and you're injecting a live virus into your body, that could mean bad news. So you have to talk to your healthcare provider first and consult them before you take that vaccine. And finally, we have the toxoid vaccine, which basically they just inject a toxin or a harmful product that's made by the germ that causes the disease into your body. All right. So moving on to some specific types of vaccines, we're going to be talking about the flu vaccine, the pneumococcal vaccine, and a lot more. So for the flu vaccine, we're going to be discussing the two types of flu vaccines. So we have trivalent vaccines as well as quadrivalent vaccines. Trivalent vaccines are basically able to protect against both influenza A and it's able to protect against 2 influenza A viruses and 1 influenza B virus, whereas quadrivalent vaccines are able to protect against both influenza A viruses as well as both influenza B viruses. And more or less, these vaccines are both types of inactivated influenza vaccines, whereas there's also another type of vaccine that you can get, which are live attenuated influenza vaccines. Inactivated influenza vaccines are typically injected, whereas live attenuated can be delivered through nasal sprays, and it's commonly used for children. So to clarify a little bit about influenza and what that is, influenza and the flu, it's something we're all familiar with, and it typically begins with influenza viruses, influenza A or influenza B viruses that enter your body. The incubation of these viruses is typically around 2 days, but it can be sometimes longer, up to 4 days, and it can be characterized by fever, aching muscles, sore throat, and non-productive cough. I also want to clear up the difference between flu and the common cold. The common cold is generally milder than the flu, and it presents with like a runny nose or a stuffy nose, and it's caused by a different virus. So getting the influenza vaccine will not protect against the cold. So in terms of should you get the flu vaccine, generally the recommendation is yes, anyone who is 6 months or older should get the vaccine unless you are taking a vaccine that's not recommended for your age group. So if you're taking the wrong type of vaccine, you don't want to get the wrong flu vaccine. Also, if you're allergic to flu vaccines or any ingredients in the vaccine like gelatin or antibiotics, you don't want to get the vaccine as well. At that point, you would want to consult with your healthcare provider. You also want to get you would also want to get the live attenuated flu vaccine if you're under 2 or over 49 years of age. Unless you are under 2 or over 49 years of age, or if you are pregnant or allergic to flu vaccines and all of those things listed over there on that column.
So, Grammy, do you have a comment on?
Yeah. So basically, there's it's actually a very good slide. I definitely would also mention that the high dose vaccine for seniors over 65, which is given also now at pharmacies. It used to be only clinics, but pharmacies have them. The HD vaccine also. It's named as HD, but if it's not available, some people want to insist to get the HD. If there is a supply issue, please take the regular one, better than not taking it. And the other thing is, yes, for the live attenuated influenza vaccine, like the flu mist, which is through the nose, yes, make sure you always, if it's a pregnant woman, or if over 49, you must make sure that you mention that in the form, and they will not give you that one for sure. But basically, yes, and it is covered by the government. It also covered for visitors when they are in, and international students. It used to be even done through the public health unit. It has been done through pharmacies in the last couple of years because some people were not able to reach the BHU because they especially if they're visitors, they're not familiar with the healthcare system. They end up not taking it, and better than going to pharmacy, it's better to do it because it's more accessible. So yeah, that's basically what I have.
Yeah, thank you. Yeah, so to touch on a little bit more about the flu vaccine, typically it's recommended by Health Canada to get the flu vaccine before November. Typically, like around October is like the best time to get it. But getting vaccinated earlier is also like really good because it's also linked with reduced protection against the flu, and this is because They recommend November specifically because winter season is influenza season, and being able to be protected via vaccine can really help you stay safe throughout. So, for example, in the chart below, you can see, from December all the way to March, you can see that there's this is the number of times that this month has been the peak for the number of influenza cases. So you can see it's very much winter dominant. And if you were looking to get vaccines, you can go to any pediatric or family practice offices, community health clinics, or public health departments. And there are some just common side effects that typically occur with flu vaccines that we've covered before. Okay, moving on to the pneumococcal.
So, sorry, just quickly.
Go back one slide.
Yeah, it's fine. And just to see how big it is, it almost kills around 3,000 Canadians every year. Luckily, we have a universal healthcare system. We have very high access to flu vaccines. In the States, in 2016, I think it was a very bad year. It killed 80,000 people. 80,000 people died of flu in the States a few years back. So that's, and as Dr. Kurnu started, this year we didn't see a lot of flu because people were really not, they were socially distancing. They got their flu vaccine, so it was really extremely low, which is a good thing.
It's actually important to realize is that for those who get vaccinated, you might still get influenza, but the severity of the disease will be lessened. The chance of you becoming very sick is important. And we also know that getting the flu vaccine decreases inflammation, also prevents heart attacks. Remember, what damages vessels is inflammation. Viruses damage vessels. So there's actually quite reasonable data right now is one reason to get the flu shot is to prevent a heart attack, and also dying from heart attacks, and also dying from influenza. So so this reminds me things like hand washing, not touching your face, keeping is that I think we're going to learn from now. And one of the things is that people say, I get my blood pressure down at the pharmacy. Don't get your blood pressure down at the pharmacy. Don't get your blood pressure down at the doctor's office. Get your own blood pressure machine and do it yourself, and go to your doctor and here's my blood pressure reading. Avoid higher risk situations. Every year the flu virus mutates, so every year it changes, and that's why it's adapted. And some years the flu is really bad, other years it's not so bad. And so to me is that this is one of the breakthrough therapies. And when you hear the idea that the vaccine gives you the flu, no. The vaccine does not give you influenza. You might get, as you mentioned, a common other virus, a cold. That won't prevent that. This is against influenza, which can be a deadly disease from some, and for other people it can leave you sick for weeks and things of that nature as well. So to me, this should be something in October. You should basically consider getting your flu vaccine every year.
Yeah, okay, so moving on to pneumococcal vaccines. Basically, these vaccines, they protect you against the pathogen in the top right, which is known as Streptococcus pneumoniae. And this bacteria is implicated in a lot of infections and many diseases, for example, pneumonia, but also near ear infections, inflammations of the sinus, as well as meningitis, which is inflammations of the membrane around your brain. And there are two vaccines that we currently have against this, PCV13, which is pneumococcal conjugate vaccine, or PPSV23, or pneumococcal polysaccharide vaccine. And both of these vaccines are subunit vaccines, so as a reminder, they inject parts of the proteins of that pathogen that can be recognized as our body, so we generate that immune response. And the difference between them is PCV13, it'll use a protein carrier to deliver those antigens into your body, whereas PPSV23 just delivers the proteins into your body directly. Typically, for my research, you typically give one dose of PCV13 followed by a second dose of PPSV23. But feel free to jump in if you have anything to add, Dr. Greening or Remy.
Yeah, that's great that you mentioned that, Frank. How many Canadian adults between 18 and 64 that have a medical condition receive pneumococcal vaccine? Is it 85%, 53%, 22%, or 17%? Just make a guess.
I'm going to say 17%.
Yeah, it is 17%. So imagine there is like a huge potential and importance to do that. The other thing with what happened with pneumococcal vaccine, we know that it came later. So people who are like now like 50s and 60s, they didn't get it when they were kids. The kids got it, so that caused the herd immunity in a way. So we started seeing lower. However, it's still extremely recommended for people for any age over for over 18. For kids, of course, it's already recommended, but I recommend it strongly for people. The Prevnar 13 is actually over the counter. So if you go to the pharmacy, you can ask your pharmacist for the Prevnar. They will pull it out from the fridge and they will sell it to you. It's around $130 and they will inject it to you for a fee, which is usually $20 to $20. And it's a one-dose thing. If you don't remember when you got your pneumococcal vaccine, it means you need one. So that's basically a very important thing to remind people with. And a couple of numbers that I was interested to read, it's that Canadians, if you ask 100 Canadians, do you think you are up to date with your vaccines? 88% will say yes. But the actual thing, only 3% are actually up to date with their vaccination. So the COVID also had a lot of delays to many of the vaccinations that people had. So somebody got vaccinated one dose, and then COVID hit, they didn't really get that. It's very crucial to catch up with this. Ask your pharmacy, they might give you the vaccine at their pharmacy. Make sure you connect with them.
So if I got this right, is that these vaccines are not covered by the government?
No, they are not. If you have a private insurance, you can get it through your private insurance.
Okay.
You just need a prescription. So let me just clarify. Pharmacists can administer all these vaccines, the intramuscular ones. However, they need a prescription from the doctor for them, except for Prevnar, which is over the counter. Patients can buy it direct. You need the prescription for two reasons mainly. It's the authorization by the doctor, because still pharmacists cannot initiate a vaccination prescription in Ontario, and you need it for coverage. So if you want to get covered, if you have a private coverage that covers the vaccine, they need a prescription to match with it.
You mentioned there's two vaccines. Tell me the sequence. What vaccine should you get and when should you repeat it?
Frank, I think you confirm with me. It's first the Prevnar or the C13 and then the sequence for the PSS. Yeah, we need one of them. Absolutely.
Thank you.
Thank you.
Yeah, so if you're looking to get these, basically, like Remy said, you should be getting them if you haven't received the pneumonia shot in the last 10 years. And also if you have diabetes, if you're a smoker, or if you're immunosuppressed, you are at risk. So you should be getting this vaccine as well. However, if you're allergic to this vaccine or any vaccine that's of the toxoid variety, you should not be getting this. Also, choose a time to get this where you are feeling good. You don't have any you don't have like a cold or anything like that, because that could potentially interfere. A mild cold is fine, but if it's progressing to be something more severe, definitely avoid vaccination. Yeah, so Remy and Dr. Kurnev covered a lot of this already. But basically, when you get this, you should be getting this like any time. But PCV13 is not covered by OHIP. Costs around $105, $130. PPSV 23 is covered by OHIP from my research, but Remy, if you'd like to confirm that, I'd like to double check.
Yeah, absolutely. Yeah, you're right. And it's usually at the doctor clinic. It's not available at the pharmacy because of the coverage piece. So people would get it at the family physician or the public health field.
Yeah, awesome. And yeah, you can get them at clinics, practice offices, or just like public health departments. And side effects are also fairly minimal. They're just standard side effects that you might normally see with vaccines. Okay, moving on to the shingles vaccine. So to describe shingles, shingles is basically like a painful rash that's onset because of viral infection. And the disease is linked to chickenpox, like Dr. Kearney mentioned at the very beginning of the presentation, because it's actually the same virus that causes chickenpox that stays in your body dormantly and reappears in later life as shingles. You can get shingles more than once, and the risk of shingles will increase as you get older. And shingles can lead to a lot of long-term complications. For example, the most common is something called post-therapeutic neuralgia, which basically means the shingles can have lasting impact on your nerves and nerve damage that can result in long-term nerve pain. So should you get shingles? Yeah, typically you should get shingles when you are over 50 years old. Even if you had shingles in the past or received Zostavax, or if you're not even sure you had chickenpox, it still is a better chance for you to get the shingles vaccine than to have shingles. But do not get the shingles vaccine if you are pregnant or if you currently have shingles, or if you're allergic to the vaccine or any of the vaccine components. When should you get them? Yeah, anytime over 50 years of age. And again, you should take the vaccine unless you meet those criteria I mentioned before of those people who should not take the vaccine. And shingles is great, or Shingrix is great because it's covered by OHIP if you're 65 to 70. Otherwise, Shingrix costs $150, give or take. And again, you can find them commonly in where you can find most vaccines. And in terms of side effects, Shingrix, 1 in 6 people experienced side effects that prevented day-to-day activities for around 2 to 3 days. But otherwise, it's mostly just typical symptoms that you might see with other vaccines. And all of these side effects spontaneously resolve.
Now let's just go back one slide there. So, Rami's going to administrate. I'm getting the shingles vaccine today. So I'm 61. I should have got it in the past, but I'm a good procrastinator. So what I'm going to do is I'm going to get it today. So now one of the things is that I've seen so many people get chronic pain. So this is Rami over here, doing it over here, and basically is that I hope I don't die today, just kidding. So I'm going to get my vaccination. And what's the cost at Shoppers Drug Mart for the vaccine?
It's around 170.
Okay.
Yeah, so the cost is actually it's around 170, not 150.
Okay.
That's the only.
And then then the cost for you to give the vaccine is how much?
$20.
$20. Okay.
And it's 2 doses, so each dose, 1 dose today, and then in 2 to 6 months the other one.
So if they get a second dose in 2 to 6 months from now, okay. Is that cost $150 each time?
Yes, it's the price of the injection, and then the $20 is the.
Okay, so you need to have 2 shots of that sort of, and the thing is that it can involve your eyes, and so there. Do you have any thoughts about shingles and things on the issue as well? What's your take on shingles yourself?
Yeah, it's extremely. There is no problem. There is no single week we don't see a shingles case with a patient. Usually they are immunocompromised or they're over 50 actually. It can hit you even if you don't have a major immunocompromised situation. If you're stressed out, your immunity will go down. You will find sometimes that you develop shingles. And it's very painful. We see people going to the... it's not people would go because they can't really figure out what's going on, and it's very painful for them. They go to the emergency, and it takes only you only need to take that vaccine to about reboost your immunity, even if you got the chickenpox when you were a kid. So I totally I've seen lots of positivity around it. Even if people get, again, the severity of the disease will be much less if they get the vaccine.
Does Frank know how effective the vaccine is?
It is. I don't recall the percentage, but it's a very good percentage. It's definitely over 70%.
Okay. Frank, did you get any funny information how effective the vaccine is at all?
I remember coming across it, but I don't remember it off the top of my head.
I can
Well, we'll check up on that and get back to people at a later date. But now, if you got shingles, when should you get vaccinated after getting an attack? And does having shingles boost your immune system?
Having shingles boosted for the shingles for a while, but definitely if you get it when you're older, it's definitely not a good thing. So definitely, I see that it's really crucial to take the vaccine for sure.
Okay. So what we learn is that as we get older, our immune system gets weaker, and so that's why you wait till the age of 50 years of age. The government has decided to vaccinate people the age of 65 to 70. And again, so I maybe should have went 10 years earlier, but and Remy said only 3% have our proper vaccinations up to date. So I have to get my another one in another 2 to 6 months from now. I'm going to ask Remy to give me a reminder, and I'm sure he has a reminder system about that. And that's the beauty about having good people around you to help. And I just want to just say that I've been privileged to work with a very good pharmacist, and we're going to talk more about the pharmacy role in your health in general. So lots of things to talk about. And so is that you mentioned people who have diabetes, you smoke, overweight individuals, the things that, again, that we learned from COVID-19, the same thing for other immune diseases. And so thank you for sharing that.
Thank you, Doctor, for the kind words. I also advise people that, especially if it says 50 plus, many people are still might be still working when they're 50. They might have a good plan that can cover that. Ask, get it done. It's a good idea. So you can end up not paying for it too. But if you have to pay for it, I would definitely pay for it. I've seen people who really have a tough, such as challenging financial situation. When they are and they see how important is the vaccine, they actually go and buy it, they get it, and they do it. So, I've seen it, especially in this part of the city.
So I'm happy to pay my fee for this, and thank you. And so you have to look at that for yourself, and that's on my repertoire of vaccines. Take it away, Frank.
Yeah, okay, just going back to that one question. Shingrix is actually 97% effective in preventing shingles from adults 50 to 69 years old who got 2 doses. And from 70 and older, Shingrix becomes 91% effective. So I guess the takeaway is you should get it from 50 to 69. Moving on to tetanus. So tetanus is it's an infection that's caused by a bacteria. It's called Clostridium tetani. And basically what happens is when the bacteria invade the body, they produce a poison or a toxin that can cause painful muscle contractions. And typically the vaccination for this, there are 2. There's DTaP and also Tdap. And all of these are just various acronyms for diphtheria, tetanus, and pertussis. Pertussis being whooping cough. And this is a vaccination that's all in one. Typically you get this when you're younger. And you get this again as a booster when you're 11 to 12. But if you haven't gotten the vaccine before, adults typically should be getting Tdap and not DTaP. DTaP is typically for younger individuals under 7, and Tdap is supposed to be for older age groups. So everyone who hasn't gotten vaccinated for this should get a shot of Tdap. This can be given at any time, regardless of when they last got Tdap. And this should be followed by one shot of TD or Tdap every 10 years. Tdap basically works as a toxoid vaccine, so it again contains this diphtheria toxin, which primes your immune system. And you should not be getting tetanus vaccine if you are allergic to the vaccine or any of the components, if you have experienced any brain or nervous system diseases like seizures, and this is typically more addressed to younger children, but it's better to be on the safe side. So you want to talk to your healthcare provider if you have any of those conditions. If you have ever had Guillain-Barré syndrome, or again, if you're ever feeling unwell, anything worse than a cold, avoid vaccine and vaccinations.
So, Frank, you brought that up a few times. You said if you're having anything more than a cold, you shouldn't get vaccinated. Why is that?
I believe it's because if you have like an existing virus or pathogen in your body and then getting something else, it can stimulate the immune system again even more, which isn't necessarily good to elicit that response that you want. It can lead to like confused signals. So I think that's typically why you want to get it when you're feeling good and feeling healthy.
So one more comment on tetanus, actually. Some people like to cook at home and or do some work as handy people. If you injure yourself and you don't really, even if it doesn't require stitching, but it's kind of a bad injury in terms of the cut, and you don't recall the last time you got your tetanus, it means you need to take an appointment, make sure you go to the physician and get it at the family physician, because it has to be boosted every 10 years. Many people are really behind on it, and it's very crucial. If you end up with a cut because you're cutting the chicken at home, or doing some handy work and the hammer hit you, you might get with a very bad infection that can hit your whole system if you don't have it. It takes just that tetanus shot does the magic to work for, to protect you. It's very important. Every 10 years we need to boost it with the tetanus. And as you said, it's actually a combination of other ones, but definitely tetanus is very crucial.
Is that one a covered vaccine?
It's covered, and it is, again, at the public health and the family physician office.
Yeah, so something I found kind of interesting about the tetanus vaccine is Tdap, although it's approved for those 11 to 64, it's not approved for those over 65. But it is recommended for people to be taking Tdap over 65, although like there isn't that official approval. And then DTaP obviously is approved for those under 7 years of age, so it's for the younger populace. And again, you can get them in the typical places you can get vaccines, and this is covered by OHIP, which is great. And side effects, typically, they're just the common side effects you see with vaccines, but also additionally, like swollen glands and rashes may develop with this vaccine. All right, hepatitis B. So hepatitis B is basically a disease that means inflammation of the liver. It's when the liver becomes inflamed or damaged. And hepatitis B is often caused by a virus called the hepatitis B virus, although you can also get hepatitis through a variety of other ways. Basically, any time when blood, semen, or any other body fluids from a person infected with a virus enters your body, so it travels through bodily fluids. And you can minimize risk for hepatitis B without having to get a vaccine if you just avoid sharing needles, if you avoid unprotected sexual contact, or just generally staying away from blood and other bodily fluids. You also have hepatitis A and hepatitis C, which are two other diseases, and these are just caused by two other different viruses, and the difference is hepatitis A is shorter term, where hepatitis B and C are also both short term, but the virus for Hep B and Hep C can linger in your body and become lifelong chronic hepatitis B or C. And hepatitis B has a vaccine, where hepatitis C unfortunately currently does not. And there are also combinations of vaccines that include hepatitis A and hepatitis B together. And generally, the older you are, like if you're over 6 years old and didn't get hepatitis B when you were younger, it becomes gradually less likely that hepatitis B will progress chronically. But if you do have chronic hepatitis B, it can lead to liver cancer and cirrhosis because your immune system basically isn't able to clear that virus out.
Frank, actually, it's extremely crucial also to mention the fact that hepatitis A can be transferred by fecal oral route. So if you eat in a place and it's not really that likely, you might get it. Some people call the hepatitis A the flu of the liver. The flu like it's like the fixed liver. It's not as serious as B, but I recommend strongly both the A and B, the both combination to be given. People who are traveling also, they are at risk because of you can't guarantee the hygiene some of the places you eat at for the hepatitis A. And you also, if you end up in a hospital for whatever reason, you might get the hepatitis B if there is a blood transfusion done. So it's extremely important for anybody, actually, to do the vaccination for A. It's really worth it. It's very good that we have it. Hopefully they will find something for C soon, and that would be better.
So what's kind of interesting is hepatitis A is a self-limiting disease. You're not going to die from it. It can cause you misery. Hepatitis B and C can cause misery and can kill you. And when I was an intern, I saw some complications of hepatitis B, and same thing in our hospital. In fact, when I first started my internship, this is when HIV was sort of coming to kind of present, where people actually died of something called sarcomas and pneumocystis pneumonia, which is now put at bay. You cannot get rid of hepatitis or HIV, but you can actually suppress the virus activity. So we learned a lot, and people have worked very hard on viruses against HIV. It has not been successful at this stage. But saying that it's very treatable, hepatitis C is very treatable too as well. You can go for very expensive therapy to actually get rid of the virus out of your system. It is very, very expensive. And the best thing to me is that you start off saying, watch about, bad food, bad water, bad, so that can be for hepatitis A, but you're not going to die from it. Hepatitis B, I'm pleased to say that I got vaccinated, and I believe if you're vaccinated once in your lifetime, that's sufficient. Is that still true?
It is a good thing to get it once. That's sufficient. They recommend for one more dose. It's 3 doses, and there is an accelerated form where you can get it in 0 days, which is the first day, 7 days, and 21 days. So if you're in a hurry, you can do it. If you have time, do it the recommended way, which is today, and then in a month, and then in 6 months. So if I'm not mistaken, it's a month or 2 months. It's dose, but it's usually 1, 0, 2, and 6. And then you can do a 4th one after like 10, 15 years as a booster. But it is very important to do.
And hepatitis C can be dormant for many years, and it's been recommended by some of us that people should be screened at least once for hepatitis C in their lifetime. So I think is that these are diseases that are very preventable. You don't have to die of cirrhosis of the liver because of hepatitis B anymore, and you don't have to get hepatomas, which is a cancer of the liver too as well. So I don't know what the true. Does anybody know how effective? I think they're extremely effective. I can't. I'll get Frank to maybe look that up right now, but I would assume that they're well over 90% effective. If there is chronic hepatitis B is a very preventable disease. and hopefully over time we'll learn about more about HIV and hepatitis C, how to vaccinate against that. But that's not there today. But I was lucky when I was an intern, because being in the medical field, I'm around body secretions a lot. I have people's blood spilt on me on more than one occasion, and so I'm pleased that I was able to be vaccinated successfully. Hepatitis B very early in my life. Went through a series of vaccines, and I feel very, very, very fortunate we have these available. And I feel sad when people don't look at the power of vaccines, and these lobby groups that say that vaccines are no good. Well, you started off with smallpox, polio. These are diseases that have been eradicated, and I thank the big pharmaceutical companies to come through with the vaccines against COVID-19. And without them, we'd be in a big mess. We are in a mess already, but things are getting better, and we learn. And I'm going to plead for people to boost your immune system, to get out there and get your own blood pressure machine, measure your own blood pressure, use proper sanitation, use social distancing, lots of hand washing. I have to watch myself when I mask. Don't get my mask. Make sure and don't rub my eyes and things of that nature as well. Learn those techniques, and you also showed us very importantly to get proper masks. So cloth masks are nice. They're not as good as surgical masks, and getting a 2 or 3 layer surgical mask or a series of those is a good thing to have, especially in high-risk situations. So when you're out on the street, out in the cold weather, outside, cloth mask may be good, but when you're in contact with other people, I would recommend that you have proper surgical masks that have been validated. So I'm glad today I got my first shingles vaccine, and I'm looking forward to more to come. So tell us a little bit more, Frank. What's the next step?
Yeah. So just a little bit more about hepatitis B. It's unfortunately not covered by OHIP right now. Well, it's covered by OHIP for children in grades 7 and 8, and this typically just covers like a booster, because typically you get hepatitis B vaccine in early childhood, and then it's also recommended that you get the vaccine if you're planning to travel to somewhere where you're unsure about the sanitation. And the prices, I think they can vary, but from the travel clinic that I found, it costs give or take like $74 per adult, or per injection per adult, and $65 for children. And yeah, you can get them commonly in travel clinics, but you can also find them in other places. And side effects include just general side effects that you might see with any vaccine. All right, so the final disease to be vaccinated against that we're going to be covering is measles. So measles is basically, it's an infection that's caused by the measles virus, and it can cause fever, rash, cough, runny nose, and it can eventually even lead to ear infection or pneumonia or brain damage and death. And measles can be quite infectious in the first 4 days of having measles, and after that it becomes it becomes a lot less infectious. And the vaccine for measles is the measles, mumps, rubella, varicella, or MMR or MMRV if it's including varicella vaccines. And this is a live attenuated vaccine, so it actually contains the live viruses, but these viruses are in a harmless form, so our immune system can react to them appropriately. And you should get the vaccine if you are an adult or a teen that doesn't have any presumptive evidence of immunity. And what presumptive immunity means in this case is if you don't have written documentation of having been previously vaccinated, or if you don't have any lab tests that confirm that you're immune, or if you have any or if you're actually born before 1957, because it's the last one, like the born before 1957, before 1957 isn't entirely super valid per se, but it's like before 1957, almost all people got like measles when they were in childhood, and it's presumed by some health officials that if you're born before 1957, then you would have immunity to measles because you had measles growing up. But this is just an assumption, and you should always get tested in the lab just to make sure in case you want to get the measles vaccine. And you should not get the measles vaccine if you're pregnant, and because it's a live attenuated vaccine, if you're in contact with anyone with a weakened immune system, you don't want to get the vaccine either. Also, if you have any conditions like tuberculosis or any conditions that make you bleed, or have recently had a blood transfusion, you don't want to get the vaccine as well. Measles vaccine typically is given in early childhood, but adults are recommended to take 2 doses of the vaccine, especially if you are at high risk. And this is covered by OHIP, and so it's free of charge, and you can find them typically in any places where you can find normal vaccines. And the side effects are typically just normal side effects that you see with any vaccination. And yeah, so this is a brief summary of our vaccines. Some of our vaccines here are shingles. If you want to click on the next, yeah, great. Tetanus, hepatitis B, and measles. So just a little bit of a summary slide of some information. And remember, when you're getting vaccinations, it's very important to have a record. So there's this acronym SMART. Basically, you want to have your SMART goals and consider what you want to be achieving. Basically, you want to have a record of all your vaccinations, as well as the symptoms and medications that you have had and currently use. And it's basically just good to keep all of these things in mind. Okay. Now we're going to be talking about a trial that relates vaccines to cardiovascular disease, because people with underlying cardiovascular disease, as Dr. Kearney touched on previously, they're at an increased risk for complications from influenza. Yeah, basically, it's been shown that there's a relationship between influenza and acute cardiac events like myocardial infarction or heart failure. And it's thought that the influenza vaccine can reduce these acute cardiac events. However, generally patients with myocardial infarction and heart failure also have weakened immune systems. And if you receive higher dose vaccines, this can be potentially dangerous for the systems because they're not able to overcome that load. So what this trial did is it's asking the question, can we improve the clinical outcomes in patients with acute cardiac events using these high-dose influenza vaccines over standard-dose influenza vaccines? So they were comparing high-dose versus normal influenza vaccines, and they recruited patients with MI in the past year and then randomized them to receive either treatment. And basically the results were they didn't have any significant difference between high dose compared to standard dose vaccines in hospitalization for cardiac or pulmonary reasons. And this is consistent based on age, whether they previously had heart attacks or heart failure. And they also saw, interestingly, that even though influenza is typically well tolerated, they found that there was a higher incidence of vaccine-related side effects in the people who got the high-dose vaccine compared to those who got the standard dose vaccine. And this includes pain, swelling, myalgia, which is muscle pain. And there were very, very few incidents of severe reactions with the influenza. In general, though, it just suggests that there's really no difference between the dosage of vaccines in preventing further cardiological incidents. There were some limitations of the study. For example, women and ethnic minorities who are disproportionately burdened by influenza and flu, they were underrepresented in the trial. And also that their analysis to validate whether or not they had gotten influenza, it wasn't systematically tested in the clinic by any clinical means or laboratory means. So that would be another big limitation of this study. Next slide, please.
So Rami's just going to be leaving in a few minutes here. I just want to say, first of all, thank you, Rami, for participating. And do you have any other final thoughts about vaccines in general?
Well, I've seen lots of debate about anti-vaxxers versus co-vaxxers, and it's really we're speaking science here, and I classify position of people on vaccines in general into anti-vaxxers, co-vaxxers, and vaccine hesitant people. There's three categories. The hesitant people are the ones that are not sure. They want to hear logical answers for their fears, and this presentation is part of it. I'm sure that Frank, for example, is a very young guy, and I am 45, so I can tell you that from my readings in history, I know that 60, 70 years ago, people used to live 50, 55 years. And the extension that we had in lifespan is mainly contributed to vaccination. Part of it. Like vaccination was a huge addition to our lifespan. So I don't believe that vaccination has been a bad thing. On the contrary, vaccination is one of the best advancements in healthcare. It will continue happening. It's increasing lifespan. It's improving quality of life. We're seeing. I personally, my wife allowed me to use this example. There is a vaccine for the HPV, and mainly to protect against cervical cancer for women. The efficiency of this vaccine is unbelievable. I actually recommended for her even before it was recommended up to 48 years of age, or 46 for women. It was between 9 and 26. At that time, I actually asked her doctor, off-label, please prescribe it for her, and we even paid for it because it wasn't covered by our plan. It's one of the most important vaccines that has been also developed in the last few years. So I'm telling people through this, vaccines are really something crucial for our life. They're really good. Yes, there will be some side effects with some people, but that's not the rule. 1% of people might have some adverse effect. I don't know the percentages, but there will be some adverse effect. It's normal. It's part of the package. But the benefit of vaccines are much more than the risk. So thank you for this opportunity, as usual, and I appreciate it. Thank you.
Thank you, Rami. So, yeah, it's kind of interesting. We'll probably talk a little bit more about this, but can you get any guarantees? No. And could you get Guillain-Barré from a vaccine? Yes. Do you get Guillain-Barré without vaccines? Yes. And so, to me, we're learning all the time, and I think we'll come back to it a little bit later. So I like people do their own exploration, and I always say there's two parts of the brain. The left brain is the logical, scientific part. The right part of the brain is the emotional part. Obviously, life is a mixture of both. So I know if the right side of the brain or the emotional part takes over too much, you can't be rational. So that's why we started off with the form for COVID-19. There's a form available. It's a 5-page form. You should download it, look at it, think about it, and contemplate. I learned so much about vaccines again today. I wish there's a vaccine for heart disease. There's not. Heart disease is fought on many fronts, but I also learned that you can actually boost your immune system with diet, lifestyle changes as well, and control rate factors. So we're going to thank Rami here. He has to go, but we're going to stay around and hear a little bit more things. Thank you so much, Rami. Thank you so much. Oh, we got to listen now. All right.
Thank you, guys.
Thank you
very much.
Thank you. All right. Go ahead. I'm sorry, Frank.
Oh, sorry to interrupt, but there was actually a question in the chat. I wish Rami was still here, but it's asking, can one get over-vaccinated, and do different vaccines interact with each other to produce a harmful effect? I was just wondering if you had any insight on this.
The way I would do things is I would do one vaccine at a time, because let's say you did all vaccines simultaneously, you're going to overstimulate your immune system. If something goes wrong, you're not going to know why. So I think doing things in an organized fashion makes sense. It's like when you do renovations of your house, you do one part at a time and things of that nature as well. So I think is that speak to your family doctor, speak to other people as well. Yes, I think you can overdo things in general. I'll give you an example. Over-exercise can be a bad thing. It can weaken your immune system. So I think you can do that, but our current way of doing things right now shouldn't be a problem. So if you do things in a proper sequential way, I think you should be fine.
All right, great. So Frank covered a lot of different vaccines for some of the diseases that have been going on for a while. But with respect to COVID, because we've had these new vaccines come out, they're not all the same, and they haven't been researched the same way either. So before I head into this, I just want to preface that a lot of the research in this section was done by Praveen. He unfortunately isn't able to be with us here at the seminar, but I just wanted to give credit where it's due. So he contributed a lot to the development of this section here. All right, so let's start off with a bit of info on the process of vaccine development for COVID-19. No matter what kind of vaccine it is, it always has to start off in a preclinical development, which involves the entire lab process of actually creating the drug itself. After this, then it's transferred to the clinical development stages, and especially the trial phases, as was mentioned previously. So this takes years to complete, but given the cooperation by citizens who volunteered to participate in large-scale trials in order to help push these vaccines, we have been fortunate enough to approve a few in Canada. Although I do want to point out that COVID vaccines approved are dependent on the national government. So the ones being used in other jurisdictions worldwide might not be the exact same brand names as the ones that we have approved up here in Canada. So just a bit in terms of the numbers, there's about 73 vaccines that are in clinical development, whereas about 182 are preparing to enter the clinical development phase. And these vaccines are of many different types, such as we have our RNA vaccines, viral vector, or protein subunit vaccines, as previously mentioned. However, the most common ones in development right now, especially for COVID-19, are the protein subunit vaccines, and right now there's around 20 of them out of the 73 in clinical development. So these ones, just to recap, are the ones that resemble proteins that the actual virus produces, so it stimulates our body to recognize them and to help mount an immune response. So in the future, once we get exposed to the actual virus, because they're so similar and analogous to each other, it just transfers over. Can we hit the slide? Great. I want to take a moment to quickly recap mRNA vaccines, because these are what the vaccines that are currently approved by the Canadian government for COVID-19 fall under. So in a nutshell, mRNA is like a messenger for your cells to create proteins. And they have the specific information on how to build these proteins. And we can actually use the mRNA of certain proteins on COVID. So these ones are called spike proteins. And as you can see in the red at the top right picture, and our bodies are going to recognize that protein itself. So it's useful to know that it's on the surface. So viruses and cells have a ton of proteins scattered throughout, but the ones that are recognized have to be somehow exposed so that our bodies are able to pick up on them once they're inside our system. And so back to the point, because the emulated protein is so similar to the actual COVID virus, our body thinks that it's a very small part of the virus itself, and it starts creating those antibodies that our body has in order to protect us against any future infections from the actual thing. So can we hit the slide? Great, thank you. So then we have two mRNA vaccines that are actually approved by Canada's jurisdiction. And these two, you might have heard of them before, are Pfizer and Moderna. And both have actually shown promising results, both in terms of effectiveness in maintaining immunity, as well as safety as far as adverse effects are concerned. And they've both gone through testing on tens of thousands of patients and have shown around 95% effectiveness, which is actually extremely strong, relatively speaking. One thing to note, though, is that Pfizer and Moderna vaccines, although they accomplish the same things, they have two different schedules. So both require 2 doses, one initially and then you come up for a follow-up later. But with Pfizer, you can get it completed within 3 weeks, whereas with the other one, Moderna, you can get the 2 doses 4 weeks apart. So just a little bit of differences as far as how the administration is. All right, can we hit the next slide as well? Has the slide changed for anyone else? Oh, okay, there we go. Yeah, thanks. So now we can take a closer look at the actual research that's gone on behind Pfizer and BioNTech's vaccine. So the randomized control trial is one of the most standardized methods used to look at the effectiveness as well as safety of certain treatments in comparison to a control group. So in this case, it'll be a group that has not received the vaccine. That way we can compare what the actual effect of the vaccine is, because otherwise we don't know if they would have exhibited some sort of immunity even without the vaccine itself. So having that control group is important to strike up a comparison. So in this trial, there's about 44,000 patients. They're all above age 16 and from various countries, ethnicities, and they all volunteered to participate. Half of them were given the vaccine and half of them were given a fake vaccine. So we call this a placebo. It's basically a treatment that doesn't have any medical components, but you think that you're receiving it. And the reason for this is that sometimes when we think we're receiving care, our body actually responds better. So we want to see what part of the vaccine is attributable to its actual medical properties and not just the act and our thought of getting the shot itself. So fast forward, the people who assessed their health status after getting the vaccine also did not know whether they got the real COVID vaccine or if it was a placebo. Sometimes this can make it a bit more biased if the researchers themselves know and they have a suspicion that one of them is better than the other. So by making it completely anonymous and blinded to these factors, it eliminates this aspect of bias. And it just makes the whole assessment a bit more objective. So out of the 20,000 or so patients who actually got the vaccine, 95% of them did not develop COVID-19. And this was pretty consistent across all age ranges, ethnicities, and even those with cardio risk factors, which is particularly of interest to us here. And although there were some adverse events or side effects at around 27% of those who took the vaccine, a lot of these were very minor, such as sore arms, which would actually be expected for a lot of vaccines, sometimes just directly from the injection site itself. And actually, 12% of those who had the placebo even reported those effects, which you can imagine because it also involves getting a shot itself, when in reality they didn't even receive the actual COVID vaccine itself. And out of the entire vaccine group, so if you remember that's around 20,000 people, only 4 serious adverse events were reported. So anything that's more major than the actual sore arms, things along those lines there. And the big takeaway is, I mentioned there's the study participants. They came from a wide variety of backgrounds. They had different ethnicities. And the reason they want to do this is just to make sure that the results from the study are applicable to everyone. So if you picked a really specialized group, like you only pick people within the age group of 20 to 25, and they all come from this background, and they're all from the same ethnicity, they're going to have certain characteristics. So even if they show promising results, you're not exactly confident that you can expand all these results to the general population. All right, can we hit the slide? All right, so the Moderna vaccine was really similar as far as the clinical research findings go, and about 30,000 participants from a sample that was also diverse was studied here. And half of them received the COVID vaccine, and the other half got the placebo, and the vaccine in this case was 94.1% effective. So more or less along the same lines as the Pfizer vaccine itself. And to point out, only 8.2% of patients reported adverse events, such as the side effects that we discussed earlier. And only around 30 of around 15,000 patients given the vaccine reported serious COVID cases. So again, the key takeaway from here is that this vaccine is also clinically supported through pretty intense and rigorous research, and is shown to be effective in a variety of people with all sorts of different characteristics. And also really important to note is that it has really low rates of side effects and adverse events as well. Right. So that wraps up the nitty-gritty parts of what's going on behind the scenes as to research. Now we'll talk about who should get vaccinated. So this question comes up because, as with any drug or even product on the market itself, when it's first developed and you start rolling it out, there's going to be a mismatch between how much supply there is and how much people want. So here's a couple stats from the Government of Ontario's website. As far as it was updated just yesterday, 21,000 doses a day, and the total doses administered is over 600,000. But it's interesting to note that the number of people who are actually fully vaccinated is only around half of that. So if you remember, this is because to get full vaccination, you actually need to go back for your follow-up shot. So even though there's a total number of doses, only some of those people so far have come back after the 2 weeks to get their second shot. Some of them are in that waiting period in between. Now, these numbers are really high, and it's quite impressive, especially given the short timeline that we've had. But when we consider that the total population of Ontario is over 14 million, the question arises. We clearly have this mismatch between how much supply we have as well as how much demand we have. So who should get prioritized, and how is it that we can make these kinds of decisions? And so this will tap not only into research as far as what's most effective in terms of curbing the spread of the disease, but also starts to relay a little bit into medical ethics and the decisions to prioritize and withhold treatment when absolutely necessary. So we can hit the slide again. But before we get into that, I just wanted to mention a phenomenon known as herd immunity. So this is when you get some indirect safety. This refers to people who themselves haven't been vaccinated against a certain disease, but they're still getting some safety advantages just because so many other people around them have gotten the vaccine. So let's take a conceptual look at how this might work. So in the first picture on the left, you can see that pretty much no one is immune. And so when the virus enters a population, it can just spread like wildfire. Any two people interacting, there's a strong chance of the virus jumping, and it just explodes exponentially after that. Now compare this on with the picture on the right. Even though not everyone in the population is vaccinated, as shown in green, the rate is a lot slower, because as long as the majority of people are vaccinated, then anytime two people or a group of people are meeting, there's a higher likelihood that some of them will be vaccinated, so there won't be that spread. So as far as the virus spread is concerned, it's as if those green people weren't there. So it's like the population is just really sparse and spaced out because the people who haven't been vaccinated aren't all clustered together. So this is the essence of herd immunity in a nutshell. But is there some kind of magical number that we're shooting for? Maybe a percentage or a proportion where after this we can consider ourselves relatively safe? Well, the thing is, it actually varies per disease. So some of them are quite infectious, like influenza, like the common cold, influenza, as well as COVID-19. And for some diseases that are less infectious, you don't need as high of a proportion for people who need to be vaccinated. So they've determined a couple numbers off of some statistics, and for influenza, it's about 80% in healthy individuals who need to be vaccinated, and 90% in those who are more at risk. So people who might be more immunocompromised, people who have more exposed professions. And for COVID-19, the research isn't as rigorous and verified just because of its relative recency. We've had the common cold and the flu with us for a long time, so we have a large body of research around those. But from what we do have so far in COVID, it seems that this number is somewhere around 50 to 66%. Now I wanted to bring this up because obviously we don't have enough vaccines for everyone to get it, especially in the first few days of rolling it out. But it's important to note that even in the end game, the goal isn't to make sure that absolutely every single last person is immunized, but rather that we have enough so that as a society, we're relatively well defended against the disease. Wait, we can hit the slide. Yeah, and we know that not everyone is suitable to get a vaccine, depending on certain other medical conditions they might have or allergies towards certain ingredients. And so this also varies per per vaccine, and I won't get too much into it just because it's already been discussed. But essentially, those people who aren't able to get the vaccine because of their health conditions, it's not actually such a huge problem as long as those people around them have their vaccines. I guess this also ties into a bit of responsibility. So as people who are healthy and able to get the vaccine, by getting vaccinated, we're not only protecting ourselves, but we're also contributing towards that collective immunity, so herd immunity, in order to protect those people who have no choice and just can't get the vaccine because of their health conditions. Yeah, thanks. And we can hit the next slide. Great. So just wanted to walk you guys through the Government of Ontario's plan towards rolling out the COVID-19 vaccine. So phase 1 started in December of 2020, and this is when it was a very limited number of vaccines. They were just getting imported. Most of the ones that we use in Canada are made in Belgium, so it takes a while to get them over as well as manufactured. And because it's such a limited number, these went to the most vulnerable populations, so people who are extremely immunocompromised or elderly. So it goes to them as well as their caregivers, just because we don't have that much to spare. So fast forward a bit to April of 2021. This is when we're projected to have much more increased in the stocks. And at this point, we can afford to get it to a bit more of the general population, but starting with the elderly because they are more at risk, as well as high-risk professions, such as frontline workers or essential workers as well. And then finally, in August of 2021, if all goes according to plan, this is when the vaccine will be much more widely available and the general public will be able to get their vaccines more easily. And so this is ideally when we're going to hit the phase where we're approaching the threshold of herd immunity.
All right, so we're going to now end it off with a few misinformation or fun myths that we can debunk. So the very first one, myth number 1, if I already had COVID, I don't need a vaccine. Well, people who got sick from COVID can still benefit from getting vaccinated because, as mentioned earlier, reinfection is still possible. And there's not enough information currently available to say if or for how long people are protected from getting COVID after they have had it, but early evidence does suggest natural immunity may not last very long. But again, we need more studies to figure this out. And then the second myth, a very popular one, is that researchers rushed the development of the vaccine, so therefore its effectiveness cannot be trusted. So studies have actually found that the vaccines, as I'm sure everyone has heard by now, are 95% effective with little to none serious or life-threatening side effects. So how was it actually developed so quickly then? The vaccines were developed quickly because they were created with a method that has been in development for years. So the companies could start the vaccine development process early in the pandemic. The companies were also making the vaccines earlier on in the process, even before the FDA authorization, so that supplies were ready when authorization occurred. And as Dr. Cornu mentioned as well, the vaccine developers didn't skip any testing steps, but they conducted some of the steps on an overlapping schedule so that they can gather the data on a faster scale. And social media helped companies find and engage study volunteers, and many were willing to help with the COVID-19 vaccine research.
I want to give a special thanks to those that participate in these trials, the 30s and 40,000 people who exposed themselves to an unknown risk at the time. Now, people develop vaccines, and they give, and experts are doing this, but right now it's kind of easy because, you know, hundreds of thousands of people have been vaccinated in clinical trials, and people are being vaccinated, millions of people are being vaccinated around the world right now. So it's kind of easy for us right now, but for the people going into this, I thank you. You risk yourselves, you did good.
All right. And the third myth is getting the COVID-19 vaccine would give you the COVID-19. So that's, as we mentioned earlier, many times, the mRNA vaccine, they just instruct your cells to reproduce the protein as part of the coronavirus so that your body can recognize and fight the virus if needed. The vaccine does not actually contain the virus, so therefore, by logic, you can't get the vaccine from you can't get the COVID from the vaccine. All right, and fourth myth, the COVID-19 vaccine enters your cells and changes your DNA. Well, the vaccines are designed to just help your immune system fight the infection. So, and the mRNAs of the vaccines do enter the cells, but the nucleus where the DNA resides do not. The mRNA just does its job to cause the cell to make the protein, to stimulate the immune system, and then quickly breaks down, all while without affecting your DNA. Apart from those myths, you might be wondering, what are the potential downsides or maybe dangers of the COVID vaccine? Well, according to the CDC, anyone with severe allergies, like anaphylaxis I mentioned before, to any of the BioNTech or Pfizer vaccine ingredients should consult with their doctor for the most appropriate environment when taking the vaccine. And there are also some pain-related symptoms that you would feel. According to this one study by CDC, they studied 2 million people who reported their symptoms at least once on their health checker after they received the Pfizer or Moderna vaccines. And as of January 21st, 2021, 70% of those people reported pain in arm, so that's very likely. 33% reported tiredness, less than 33% reported headaches, 11% for chills and fever, 10.4% for joint pain, and 8.9% for nausea. And that was a study across 2 million people, so that would pretty much be the minor or lesser side of the symptoms that were more prevalent. Okay, and this is just a quick video. I believe it's 1 minute long on how we know a vaccine is safe. So if it works, we can play it.
The fundamental way that we test the safety and efficacy of vaccines is by conducting a clinical trial. And so volunteers are given the vaccine. Some of those volunteers receive a placebo, and comparisons are made, as well as rigorous safety monitoring to make sure that we understand any kind of side effects from the vaccine or safety issues. So I think once these clinical trials conclude and the regulatory agencies and scientists examine the data, we will be confident that we have information about the safety and efficacy of the different types of vaccines.
All right, so that was just a quick video, and that basically concludes this entire webinar presentation on vaccines. Hopefully everyone learned a lot. I know I learned a lot on vaccinations and how important it is to be informed about it. Dr. Kearney, if you wanted to add anything.
I just want to thank everybody for their participation. This is one of these webinars I'm going to go back, look at more than once, rewind back and forth. And also is that there's lots of diseases we can vaccinate again. So I want to thank the whole team for putting this together. I thank Rami, for our local pharmacist, for coming up on short notice and vaccinating me for Shingrix. And I want to thank all of you for listening and answer your questions. So to me, it's go to different places, do your own research, get your comfort zone, and bring out your questions and look at that. So I encourage everybody to download that 5-page form, but also look at all the other vaccines that were done. So I realized that I wasn't up to date in my vaccines. I need to look at pneumococcal next. In the future, I've had my hepatitis B, I had my MMRs, and I also had my tetanus shot. I was in Africa recently, so I had a lot of extra vaccines too as well. So to me, there's just so much learning here and so much good science. And the other interesting part about this is that messenger RNA vaccines are going to have impact in this technology and other disease models. So this already has implications for cancer therapy. You can actually go after bad cancer cells with this technology, get your immune system to actually destroy them as well. So, and this has actually changed certain diseases such as melanoma and many lung cancers. And so there's so much to learn right now. So again, thank you for putting this together. I learned so much. I'm wondering if there are any questions that people have, either on YouTube or at this point in time. I'd love to hear what people have to say. Stuart, any questions out there?
So there's no questions at this point in time, but I would like to remind everyone that if you do have any questions, we'll be on for another few minutes, and we're happy to answer any that you may have. But for as of right now, the only question that we had addressed earlier. The question was, can one get over-vaccinated? Do different vaccines interact with one another to produce a harmful effect?
So we also learned that less than 70% of us are properly vaccinated. So it'd be a nice problem to get to that point. So I think for most of us, we're under-vaccinated. But again, it's your comfort zone too as well. And vaccines work best if your immune system works well too as well. So look at that. I don't know how to stop them getting older, but I know how to be age healthier at this stage. And I guess we can maybe put up a link to that the 5-page COVID form there, so we can make that easy for people to get to that if they want to look at that. So mine's all filled out, and I'm just waiting my turn. We'll see when that happens there. So I think, Stuart, I'll give you the last word.
Well, thank you, Dr. Curnew, and thank you to all the volunteers who did a wonderful job putting this presentation together. I certainly can say I learned a great deal of information. Dr. Curnew just mentioned that we will be posting the 5-page form in the description of this video for you to check out all the screening questions that you must go through before getting a COVID-19 vaccination. And you'll also find that we had a team of volunteers put together a summary sheet which summarizes most of the important information that you found in this video, and it also contains many links to resources as well for you to check out. That as well is in the description of this video. As well as if you have any questions, please don't hesitate to send us an email at drcurnew232@gmail.com. And a comment on vaccines. I always like to think of vaccines as signing a contract. You would never sign a contract without reading through it, so it's just as important to have your background knowledge and research on your vaccines. So we hope today we gave you an opportunity to get a bit of a deep dive into the many different vaccines available, not just to focus on COVID-19, but many of the other vaccines as well, for your flu shots to your pneumococcal, tetanus to shingles. We hope that we address some of the questions you may have. If you do have any further questions, you're more than welcome to send us an email, or you'll be able to find more information online by just doing a simple Google search. In the meantime, we thank you again for joining us, and if you would like to also learn more information specifically on the COVID-19 vaccine, we have created a webinar this past month, which we will also link in the description of this video for you to check out as well. Thank you so much.
I just forgot one other thing as well. Remy wanted me to mention that Shoppers Drug Mart here on Cannon Street, 232 Cannon Street, does provide COVID testing for people that are asymptomatic who need to get tested. Let's say you are going to visit somebody in a nursing home, or you want to get tested and you're asymptomatic. I've been tested myself from time to time. And what happens is all you have to do saying is that you're a patient of Dr. Cernew's, or for our patients here, and you can go to the pharmacy whenever they're open, and they can arrange that for you. Other people as well, I'm sure they can get tested too as well. Again, if you're sick, you don't go to the pharmacy to get tested. But if you want to be screened because of your concerns, or you want to visit somebody, it's a great thing to do as well. So that's a wonderful service as well. So I think we're going to end right now. We're going to stick around and just chat amongst ourselves. Those are welcome to join us. I want to make everybody be safe. I'm going to go do some stairs tomorrow morning. I'm going to try to set a new record for me for stairs. First, I have to get there on time or early for a change. You know me, I'm usually late for everything, but I still have a few more calls late tonight to do as well. And I'm going to go for a walk with the dogs tonight, and use my immune system that way as well. So I want to bid everybody a great night. And again, thank you from the team for presenting. Does anybody from the team want to add anything else? Or because I think your presentations were wonderful, very detailed. And we should also probably try to put some posts about some just getting yourself a card and keeping track of the vaccinations that you've done, because I think I'm really good at forgetting, and I think keeping track is a great idea. So I'll do that as well, and we'll try to put some links to things that are helpful to everybody. Any final thoughts from anyone? I want to thank everybody, and good night, be safe, and get healthier, and we'll see you soon.